Back in February, COVID-19 seemed inextricably linked to cruising. When the Diamond Princess was dockside in Japan in February, it had more COVID cases than any country other than China. The cruise industry got a black eye, with ships being characterized as floating petri dishes, and subsequent outbreaks on ships over the next few weeks set up a public perception about cruising that threatened the future of a $35 billion industry. The CDC issued a no-sail order in March, and only on October 30th did they replace it with a conditional sail order, which requires enough testing of protocols that, for all intents and purposes, it's unlikely cruise ships will sail from US ports carrying paying passengers before February. To address both the real issues and the perceptions around safety, Royal Caribbean Group and Norwegian Cruise Line Holdings, two fierce competitors, put together what they call the Healthy Sail Panel, composed of experts in epidemiology, marine operations, public policy, and medical academics and related experts to break down every component of cruising and come up with best practices to make cruising not only safe in perception, but perhaps safer even than a land vacation. Royal Caribbean Group CEO and Chairman Richard Fain led the charge from his company, and former Utah Governor and former US Secretary of Health and Human Services Mike Leavitt was co-chair of the panel, along with FDA Commissioner Dr. Scott Gottlieb. Welcome, gentlemen. Richard, let me begin with you. How did the idea for the panel come up, and was the idea to reassure the public, reassure the CDC, or both?
First of all, thank you for having us, and it's good to talk to you, Arnie. Actually, I would say the impetus was neither. It was to develop the best protocols that we could. It wasn't to reassure, it was to change. And remember, 8 months ago, when we were starting on this process, the level of knowledge of the disease and of how to deal with it was really very small. And so both we and Norwegians saw an opportunity to put together the leading experts and find the right way to sail safely. This was really a public health exercise, not a reassuring exercise. And to do that, in my very first conversation with Governor Leavitt, we talked about the need for this to be transparent, because for two reasons. One is, when something is open, you get more input into it and people feel that they are doing something cleanly and openly. And secondly, you get other people to come in and tell you if they think that you could do something differently. So we had observers from other cruise lines who had their own experts advising them. We had other experts come in. We even had the CDC sending some senior people to participate. So that was the objective.
Now, Governor Leavitt, you've spent a good portion of your life in government and still serve on public committees. What led you to decide to accept Richard's invitation to co-chair the panel? What did you see as the opportunity?
I was persuaded that Richard and Frank Del Rio, as CEOs of two large companies, wanted to find an answer to the question, what are the conditions that are required for the kind of sailing they do during a pandemic? And I could see that this was a problem that could actually contribute to solutions across industry, not just the cruise industry, but across all industries. On a cruise ship, it's a unique challenge because you have hospitality, hotels, you have restaurants, you have spas, you have recreation and events. There's retail. They're like little floating cities. And if we could find a solution to many of those problems, we could actually contribute not just to one industry, but to the problem in its entirety.
Oh, so were you involved in selecting the members of the panel?
Yes, we actually, Dr. Gottlieb and I, with input from the cruise lines and drawing upon the advice of many others in the public health industry, made the decision on who would be on the panel. And it came to a clear understanding with the CEOs and the leaders of the two cruise lines, that the panel itself would be advising the cruise lines, but we would act in a way that was independent because the quality of people we sought would have it no other way.
So Richard, how did the panel actually work? Were there members broken down into subgroups to address the various components of cruising that the governor just mentioned?
Well, actually, I'll make some first comments, but I think the governor's better able to handle that because I came to the very first meeting to welcome everybody and was fairly quickly thanked for welcoming and then uninvited from future meetings. The panel operated as we had hoped it would by itself. And yes, there were the full panel meetings and sub panel meetings. I just have to say, as somebody who watched it, I was thrilled. First of all, the governor and Dr. Gottlieb told me once they had assembled the people that they were inviting, that every single person they asked saw the challenge, was excited by the challenge, and every single person that they invited accepted. And then I've watched it. There's been an intensity where they don't have answers by themselves. They get the answers. It's been a terrific thing to watch.
So Governor, let me redirect this to you. Was the committee itself broken down into groups that addressed the various components, or how did you structure the panel in that way?
Earlier, you mentioned the fact that the members of the panel come from across the discipline areas. We had experts in ventilation. We had experts in the capacity for disinfection. We have experts in public health. These were some of the world's most respected public health officials and former officials. They worked hard. We started, I think we've been at this now nearly 6 months, but during the first nearly 5 months, we met every week and we met multiple times many weeks. We broke the panel into work groups. There were 4. We later added a 5th work group. And we would receive from the cruise lines their proposals on how they would go about this. And then we would analyze them, make suggestions. And in the course of time, we had another opportunity that was presented to us, and that is that the Centers for Disease Control put out a request for information, asking that people supply them with their best thinking. And so over the course of time, through this process, not only did we respond to the plans that were being created by the cruise lines, we assembled 74 recommendations that could be used by anyone in the cruise industry, and for that matter, anyone who's in an area that relates to the cruise industry. One of the things that Richard and Frank, the CEOs of the two companies, told us is that not only did they want this to be done right, if there were resources that we needed, this was a big industry issue and that we should ask, and they would give us whatever we needed to do this well. They also said, we want you to share this with anyone because safety shouldn't be something on which we compete. And so that's the basis on which we invited other cruise lines to provide their experts. This was clearly the center of gravity for safety conversations when it came to COVID-19 in the entire industry.
So we all know the protocols that we have been drilled into us: wash your hands, wear a mask, social distance. What did you discover? What did the panel discover, if anything, that would be considered perhaps a new protocol or a new idea that they came up with?
Well, over time, you'll see evidence of a number of innovations that have come from this. One will be the way tracking and tracing can be done on a cruise ship if there is an incident. Another is ventilation. We actually had experts on ships doing ventilation studies to see how the air actually does flow and how it can be done. There'll be a number of different innovations, some of which are still being developed, and I don't want to go into a lot of detail on simply because they're not yet fully baked. But we will have not just produced protocols, we will have produced genuine innovation.
And actually, I would add something to that. I think a lot of companies and a lot of industries have put together expert panels. I think there are two things that distinguish this, at least from my perspective, and I think from Frank's as well. One was the kind of people that we use, that were members of the panel. They not only were experts, they weren't just academic experts. These were people who had experience dealing with these problems on national and international levels. So the caliber of the membership really made a difference, both because of their knowledge, but also their experience on the ground in doing these kinds of things and solving these kinds of problems before in other circumstances. The other thing, which I've already mentioned, was the transparency. It meant that they could come up with conclusions and people could come back and say, well, wait a minute, I've thought about this. People from other cruise lines, people from the CDC, people from anywhere could come back and cause people to rethink it. And that transparency gave it an openness and a credibility. And the result was, I think, that people accepted it more. And in fact, we've seen that the CDC has been complimentary towards the work of the panel. It clearly informed their work, and every other cruise line in the industry has essentially said they would accept and abide by the 74 recommendations of the Healthy Sail panel. So, and that credibility is very important, that we're all working together. As the governor said, we don't compete on health or safety. Now, it's every one of our intentions to crush the other one commercially. And unfortunately, I'm the only one that will win that battle. But on health and safety, there's no fighting, there's no competition. And we regularly shared information, ideas, and innovations.
And can I add, this is not, we've submitted our 74 recommendations. The cruise lines are now in the process of discussing how they will best return to sailing. But this process isn't going to stop. I think, to the credit of the cruise lines, whenever there's something to be learned, there needs to be a place where that can be understood and put into context. And so the expert panel continues. We have regular meetings. We met last Friday and had a lengthy discussion about a series of specific topics. If there are incidents that, as there was last week on a smaller cruise line, we're learning all we can about what happened and why it happened and what can be learned from it, because our objective is for the entire industry to continue to improve on a continuous basis. This is a new risk that none of us have had to deal with in the past. So we're literally gathering information, developing data, and ultimately creating wisdom about how best to deal with this new risk.
So, Richard, in reference to what Governor Leavitt was just talking about the Sea Dream cruise ship and it wasn't under the CDC restrictions because it's both too small and it doesn't stop at U.S. ports, but it generated a certain amount of news because of the 5 positive cases on board. So Royal Caribbean has ownership in 2 major cruise companies in Europe, TUI and Hapag-Lloyd. And they resumed sailing in the summer. And I understand that there were cases of COVID on some of these ships, as well as on MSC and on Costa cruises that were also sailing in Europe. But there were no widespread outbreaks on the ships. So what are the protocols when you do find a case of COVID-19 on board a ship?
So, I think I'm really glad you raised that, because what we have seen in the past is that people aren't so much afraid of coming down with the illness. They're afraid of being their vacations being ruined, or they're being held in a kind of quarantine, which actually makes things worse. And that's what they're concerned about. So a lot of the focus of the companies, a lot of the focus of the Healthy Sail panel, a lot of the focus of the CDC was, how do we handle a case when we do have it? And I think that's actually one way of saying it, and we've been very explicit about this. You can't eliminate COVID-19 in society, and you can't totally eliminate it on a cruise ship. The objective wasn't to totally eliminate it. The objective was to make the cruise ship safer than you are in your hometown. And we think that is possible. And the objective is not to say there can't ever be a case on board, but that if there's a case, it is isolated out and it remains a case rather than an outbreak. And you've mentioned it. We've been having tens of thousands of guests on board our ships, not just our ships, but other people's ships in Europe. We're about to start operating in Singapore. And in all these cases, yes, there have been cases, but they have been individual cases or family groups, that sort of thing. And they then are isolated. This is very similar to the success you've seen in so much of Asia, where when they have instances, they isolate those instances instead of simply closing down society. And that's the objective on board the ship. So the Healthy Sail Panel and we and everyone else have come up with plans so that you have pre-agreed and drilled examples of how to, what to do. We have arrangements with the local authorities. One of the problems that you had before was that people were trying to make decisions on the go about something that they didn't understand. So people who had no idea how a cruise ship operated were suddenly making decisions quickly, suddenly, and without the background or knowledge. We've now acquired months and months and months of knowledge about the disease, about how to contain the disease, and how to contain it. So it's a very much a focus of the whole industry and of the Healthy Sail Panel.
So I believe you were both on a phone call with Vice President Pence and CDC Director Robert Redfield to discuss the resumption of sailing. And at that point, the Healthy Sail Panel report had been released with the 74 recommendations. What was the governor's or the government's reaction? And has the CDC given you any specific feedback on the work of the panel? You said that they had you've had some interaction with them, but are they more or less signed off on it and ready to say, if you can make this happen, you can get back in the water?
The CDC was most interested to see how the industry would organize themselves to improve. And the virtue of those 74 recommendations wasn't just the creation of a checklist, it was the demonstration of a commitment to not only implement all 74 of those recommendations, some of them with substantial investment behind them, but also to validate that those things have been done and that they will happen on an ongoing basis. And they've been very complimentary. They may have had minor differences on some of the 74. We've had some discussions about that. I expect that at some point we'll get some formal response. But I think what you can assume is that the issuance of the doing away with the no sail order and being able to implement a pathway to sailing with the new order is a response to that. They can see that the industry has made a lot of progress. It's a contingent ready to sail. That is to say, you've got to demonstrate that this, in fact, you've accomplished this, and you start off slow. This is not going to be putting 2,000 people on a cruise ship and heading off for a 10-day cruise. It's going to be a small step at a time until all of those things have not only been demonstrated, but we've also learned from them. We'll refine them as we go.
Did you also get the sense, as it sounds like there with 74 recommendations, that a layering of protocols is ultimately the way that things have to go?
In public health, when you're dealing with an infectious disease, the term that's often used is Swiss cheese. And it's a metaphor on the fact that Swiss cheese has holes in it. And so you have to put one layer after the other so the holes don't line up. Masks are a valuable thing in certain cases, but they're not perfect. Tracking and tracing is an important component, but it's not perfect. Vaccines are going to be a big boon to this, but it's on its own, it's not perfect. So you have to have layers of protection, with each layer essentially eliminating some degree of risk, never getting to zero. But our goal, as Richard has articulated, is to make a cruise ship safer than Main Street. And given the fact that it's a contained environment, that seems very possible.
So one of the things that you can control a lot on the ship itself, but people don't just take cruise ships to stay on the ship the whole time. They also go on shore. That's an attraction, a marketing attraction, certainly when you're selling the cruises. So what are you doing to allow people to go on shore and then come back onto the ship without potentially bringing the virus with them?
You know, it's not just an attraction on the ship. It's a key part of the experience. The destination is one of the most important considerations to our guests when they're deciding which cruise to take. And so it's very important we get that right. At the same time, it's very important that we not do something that undermines the basic premise of our protocols. That if we have a bubble, that you suddenly have a way in that's outside the others. But it's also important, you know, part of what I'm very proud of is our ability to help the economies of the countries that we visit, the locations that we visit. I mean, these people depend on us for their livelihoods in many cases. So this is an important part of what we're doing. And so, yes, we're going to start more slowly, and we're going to make sure that the shore excursions, what we bring them to, are protected so that they don't bring something from onshore back onto the ship and into our bubble. But that's very much doable. We're going to work with the local authorities. We're going to work with the countries. We're going to work with the other providers. And so that they will essentially be doing something analogous to what we're doing on the ship. So it's an important part of the product, and it will continue to be.
Arnie, can I just cite that as an example of why the expert panel found this such an intriguing project? Because we're not only helping an industry, we're also helping dozens and dozens of port cities. We're helping private contractors at each stop in improving the level of public health, not just in their country or their community, but also in their company. This is going to have a ripple effect that goes through the entire industry and to substantial numbers of communities, because the cruise industry is working so hard to figure out how to continue to sail, but to do it in a healthy way.
So everything that you've said speaks to the reality of trying to make cruising as safe as it could possibly be. There is also the question of perception. With the developments that have come on with vaccines over last week and this week, do you think that will give a boost to the consumers, to the public who might be getting on the ship psychologically? Is the vaccine what they're waiting for, and will that help tremendously in getting the ships back sailing?
Well, Richard's the expert on this.
I wish I were an expert, but clearly perception is what we deal with each and every day. And I couldn't have asked for more good news. Seeing these two new vaccines, and by the way, it's not only good for us now. The fact that they could come up with a vaccine so quickly, and the fact that the vaccine not only reduces those who get infected, but Moderna just announced that it actually meant that the few people who slipped through and who got infected had much less severe cases. The other thing which is particularly unique about these messenger RNA vaccines is that because of the way they deal with they're not unique to the disease they're dealing with. They're really unique to a way of getting to a disease or to a virus or to a cancer. And so this technique is going to be very valuable, very helpful in going after other illnesses, even cancer, things that we haven't dreamed of being able to deal with. So if you have to look for a silver lining in a very dark cloud, I would say that's it. But yes, that helps the perception. The improved medicines help the perception, the better treatments, the better tracking, the better testing, all of these things, I think, augur well for us to have a much better 2021.
Thank you so much.
I'll
I'm
just
sorry.
make a bit of a prediction on this. There's a lot happening right now with vaccines and the question of whether people are actually feel like they're safe. And my guess is there'll be a group of people who rush out and say, give it to me, I trust, and I want to have it. And 30 or 40 days later, when things have turned out well for them, there'll be an even bigger demand. And I suspect the same will be true for cruises. There's a group of devoted cruise patrons that are going to be out there and wanting to volunteer to be on the trial sailings. And once we can demonstrate that this is being done safely and that people are having the great time that they've always bargained to have, I think this industry will snap back rapidly.
Thank you very much, Governor Leavitt, Richard Fain. Thank you for sharing all this with Phocuswright, and I'm sure I'll be talking to you again soon.
Thanks, Arnie.